the last several months, several individuals, several celebrities and others, they have been cryptically talking about pray for Deion Sanders. We know he had issues with blood clots. He had to have 2 toes removed. But today, the news conference, he shocked everybody when he revealed that he was actually diagnosed with bladder cancer. Deion went in for routine checkup and related to the blood clots. And then when they went to a urologist, they did a test, came back and said, hey, we got a problem. They found there was a tumor on his bladder. They made the decision to remove his bladder, rebuild a new bladder with his small intestines. And he was very frank, open, and honest about his procedure, what his life has been like, and also how he's been leaning on his faith from day one.
We're going to kind of break it down to you like we did our team. And it was so wonderful seeing the team yesterday. My God, it was so darn wonderful. Bucky compiled a wonderful video to let them know every step of the way so we wouldn't have to explain every detail. But it was phenomenal. I wish we could show you all that same video. It was extraordinary. I think Bucky's going to put it on his YouTube channel soon after this. But let's get started. Let's kind of give them, let's walk them through. Can we do that? Is that okay with you all? That we walk you through? Let's go, Law.
Okay, so as you guys know, Coach has his other health issues, his vascular stuff. So every year, Coach goes for a CT scan of his vascular pattern to make sure, the blood clots are away. So with this scan, everything turned out really great from the vascular side. About 2 weeks later, we get a text from his primary care doctor that said, I need to talk to you and Coach. We need to refer you guys to a urologist. So about 3 days later, we go see a urologist. They go in for a quick procedure. The urologist told us, hey, within 10 minutes, I can tell you guys if he's gonna need another procedure or if we just need to do these follow-up appointments. And the doctor told us, okay, you guys are going to need another procedure. I'm gonna refer you to my colleague, Dr. Kurkasia. But at this point, you have a bladder tumor. And from there, we'll go get it removed. And then Dr. Kurkasia, it was, go ahead.
Yeah, so we proceeded with removal of the bladder tumor. It showed a very aggressive
Let's go backwards because you guys gave me options that scared me to death.
Oh, well, once we knew.
We'll get there. I'll get there.
Okay, I'm sorry.
We removed the tumor. It was very high grade, invading through the bladder wall, not into the muscle layer, something we call very high risk, non-muscle invasive bladder cancer. So we did discuss options. We discussed some options of treatment in the bladder, and we discussed bladder removal as well. Given his commitments to his family and to the team, elected to undergo a bladder removal. We performed a full robot-assisted laparoscopic bladder removal and creation of a new bladder. And I am pleased to report that the results from the surgery are that he is cured from the cancer.
You can clap, it's okay. Rick was aware of what was transpiring, and he's been A1 and down there, just a blessing. Came to Texas to see me as well. But this was not an easy task because it was a changing kind of a lifestyle. And with Lauren and I coming from Jackson, this is how many surgeries?
From 2021, this is surgery number 14.
Surgery number 14. I had more surgeries out of the game than I did in the game. Like, what is going on? So, but they were so wonderful. You were such a blessing, guiding me to, taking me through, verbalizing every darn detail so that I could make an educated decision, which some didn't want me to go that way. They wanted me to go the other way. But I trusted and believed in you 100%. And the process wasn't easy. Just like it was some scenes that you saw, all the bull junk that transpired on draft day. It wasn't just that. It was just I knew as well I had a surgery coming up. My sons to this day don't know what transpired. I just told them something with my foot, again, because I wanted them to focus on making the team and not focused on dad. So they really don't know. My daughters do, and this joker right here, much love to my son, Junior, who have not left my side since we found out what was taking place. Not one day. He's been with me here, been with me in Texas, been with me everywhere, every day, and I've seen his handsome face. And I love you to life, son, and I thank you for everything you bring to the table. But this wasn't easy. Men, everybody, get checked out. Because if it wasn't for me getting tested for something else, they wouldn't have stumbled up on this. And make sure you get the right care, because without wonderful people like this, I probably wouldn't be sitting here today, because it grew so expeditiously, I could say. But please get yourself checked out, especially African-American men. We don't like going to the doctors. We don't like nothing to do with a doctor. You know that. So I'm not just talking to the brothers. I'm talking to my Caucasian brothers, my Hispanic brothers, my Asian brothers, my everybody, and my sisters. And that's all, y'all. Get checked out, because it could have been a whole another gathering if I had. I'm thankful. It's been a tremendous journey. It's been tough. I think I dropped 25 pounds. I was like a Atlanta Falcon prime at one point, and just dealing with the catheter, dealing with all the stuff that I had to deal with. And right now I'm still dealing with going to the bathroom. Like, it's a whole life change. Like, I can't, and I'm gonna be transparent, I can't pee like I used to pee. It's totally different. And she not only is a blessing, but she provided other persons that have gone through what I've gone through, so that I could talk to them and get some solace and understand like what I'm facing, not just from a doctor, but from another individual. And to have that been told, like, it's a totally different life. I mean, thank God. I depend on depend. You know, if you know what I mean. I truly depend on depend. Like, I cannot control my bladder. So I get up to go to the bathroom already 4 or 5 times a night, but then I'm sitting up there waking up, you know, like my grandson. We in the same thing, you know. We got the same problem right now. We going through the same trials and tribulations. We're trying to see who has the heaviest bag at the end of the night. Like, it's ridiculous. But I'm making a joke out of it, but it's real. Like, it is real, it is real, it is real. So if you see porta potty on the sideline, it's real, okay? I'm just telling you right now, you're gonna see it. You're gonna see the practice, you're gonna see one, because it is unbelievable. Like, dozing off and waking up, first thing I'm grabbing my crotch to see if I peed on myself. And it's just totally different. And I know there's a lot of people out there going through what I'm going through and dealing with what I'm dealing with. And let's stop being ashamed of it. And let's deal with it. And let's deal with it head on. And there's so many other companies out there that do a wonderful job, but I'm thankful that, we have a relationship with Depend, and we're making some other products, trying to make other products that to help all of us through. But it's been tremendous. These two, Lauren came down to Texas and was there with me during the whole way, up walking our miles in the morning, because Doc made sure you better walk, you better be active, and we did it until it was some points that I couldn't even get out of the bed for a week at a time, you know. But she was there. I remember yelling 2 o'clock, "Oh, Lord!" You know, because I have 2 bags, right? Mm-hmm. One was what?
Both were urine, but one it was filled quickly. Very quickly.
Yeah, like blood in urine. It just looked bad, you know, and I'm fishing with 2 bags. You know, I'm trying to make life happen, and couldn't come around my team, and I wanted to be here with my team. I wanted to see the new talent that we brought in. I wanted to see them work, see them train, coach them, and I couldn't. But slowly but surely, I built myself back up to where I'm able, I'm strong, I'm ready. I'm still probably about 12 pounds down. I'm gonna get that right. I'm gonna fill these overalls up like no other. But it has been a tremendous journey, and I'm truly thankful that God is so good. God is so good. You have no idea. You have no idea how good God has been to me. For me to be here. You have no idea.
Folks, this is a video posted on Deion Sanders' Instagram page, actually showing him fishing. He loves fishing, and you actually see how he has the 2 bags he's talking about sitting there on the table. He's got the tubes connected to him. Absolutely, Coach Prime has lost a lot of weight. It was so funny at one point in the video, he talked about how he's changed his numbers 2 or 3 times. He's going to do it again. I had hit him up a few weeks ago. Somebody was like, wrong phone number. Dr. Leslie Dean, Professor and Chief of the Division of Urology at Howard University College of Medicine, joins us right now. Dr. Dean, glad to have you here. So, first of all, explain this idea of rebuilding the bladder. That really blew me away when the surgeon said they took portions of his small intestine and rebuilt his bladder, How?
Great to be with you, Mr. Martin. So rebuilding the bladder is important because there needs to be a reservoir in place for the urine to collect. The small intestine is used for that purpose, and it is basically, as you know, the small intestine is a tubular structure. That is detubularized and fashioned into a reservoir, much like a ball or a balloon. And then the ureters, or the tubes coming from the kidneys down to the normal bladder, are sewn into that reservoir. Subsequently, it is anastomosed or connected to the urethra, which is the pathway out of the bladder to the outside, basically the tip of the penis. And we do that so that a person can avoid having a bag on the outside as a permanent solution.
So when he's talking about having to wear these two bags, that's temporary, or is that his life moving forward?
That usually is temporary, and I suspect what the 2 bags are for. One is a catheter into the urethra that drains urine from the bladder to the outside, and the second bag is probably a suprapubic catheter, which goes through the abdominal wall and into the newly created bladder. They both drain into a bag temporarily to allow all of the areas that are stitched back together to fashion that reservoir to heal. And that's the reason why the 2 tubes were likely there.
So during the news conference, the surgeon said that they caught this tumor on the bladder, but it had not been attached to bone, where if it metastasized, she said that folks have, 10% folks live beyond 5 years. So she said that this was a very aggressive form of bladder cancer, and because of the checkup for the blood clots, that's how they were able to find this so early.
Yes, and I suspect, based on the press conference and what was said by his physician team, it sounds like it was picked up on the angiograms or on the CT angiograms that were done for the blood clots. So that usually will include pictures starting in the abdomen and going all the way down the legs to look at all of the large arteries going to the legs. And included in that field would be the bladder. And they probably detected a mass inside the bladder, which then prompted all of the additional investigations and referral to a urologist.
So how do you, because this is one of the issues that also was raised during the news conference, symptoms, things along those lines. And so, what does a person look for? The surgeon said that bladder cancer is the fourth highest cancer for men. And so for people out there who are watching, who are listening, what do you pay attention to? What are you looking for?
So the main things are, if you see blood in your urine, that's a problem. And blood in the urine, in the absence of any symptoms of a urinary tract infection, should really raise the alarm bells. Many times this is picked up on a routine urinalysis that shows microscopic blood, so blood that you cannot see. And that will also prompt referral to a urologist for further evaluation. Additionally, a change in your urination habits, so meaning that you are going to urinate quite often, you feel that there's some pressure down there to urinate. You may also have some discomfort or burning when you urinate and empty your bladder. Those also can be symptoms of potential bladder tumors, including urinary frequency and urgency to go. Now, most commonly that is due to an enlarged prostate in men, but sudden changes or changes in the urine pattern should raise an alarm bell.
Last question before I go to my panel. So, Coach Sanders joked about there being a porta potty on the sidelines, him going to the bathroom a lot. So, having with this diagnosis and having bladder rebuilt, what is that life like? He talked about wearing Depends, joking about him and his grandchild. What is a person's life like moving forward, having a bladder removed and now rebuilt, and then having a bladder cancer?
So one of the main long-term risks with having a new bladder created inside the pelvis is urinary incontinence, which is what he's referencing. It takes some time to regain control, and that basically involves doing Kegel exercises, exercising the muscle that you would use to prevent yourself from urinating, to strengthen that area, and also strengthen the pelvic floor musculature. And then it takes some getting used to the sensation of what that new bladder feels like as it fills. It doesn't feel normal. It feels more like a pressure. So you have to get used to knowing how much you're drinking and typically how much urine you produce in a given period of time, and then basically time the emptying of the bladder and get used to that new sensation. I think he was joking a bit about having the porta potty on the sidelines, etc. But these are things that he will get used to over a period of time, and most likely will regain a substantial amount of control, if not full control.
So he's talking right now about what his life like is now, but what you're saying is over time, 3, 6 months, 9 months, a year, then you sort of get back to almost normal, if you will.
That's correct. Normal sensation is probably not going to come back as in terms of the native bladder or the bladder that you're born with, but you get used to what it feels like, what the new feeling feels like, and you can temper your activity based on that.
And it's really interesting, you talking about those Kegel exercises. Dr. Rachel, who's a sexologist, she does with a lot of men who have prostate issues. That's one of the things that she also, when she's helping men who've had prostate cancer surgery, do the exact same thing.
That's exactly correct, because when the bladder is taken out for bladder cancer, in a man, the prostate gland is also removed.
Gotcha. Questions from our panel. Larry, you first.
Yeah, so I wanted to highlight something he mentioned in terms of, he highlighted Black men and preventative care. And we mentioned prostate cancer, which impacts Black men. I know Howard had their recent, white coat ceremony there at the university. And so can you talk a little bit about the importance of same race physicians, particularly, like I said, we have cultural mistrust relating to certain groups, particularly Black men. Can you talk about the importance of having more Black physicians in the workforce?
Yes, absolutely. So I think that this is very important. Cultural sensitivity is important. Understanding what matters within the community that you are entrusted to treat matters significantly. And training Black doctors is very important. I don't think that there's any dispute in regards to the literature that when there is race and ethnicity congruent care, that the overall outcomes are better.
Omekongo?
So, Dr. Dean, one of the questions that I have is, I was told as you get older, going to the bathroom more frequently is like a normal thing. And when you're talking about that could possibly be a symptom of some of the things Deion was talking about. In the same ways that men are always advised to get their, prostate examined, are there other types of things that people could do during a normal checkup that could possibly hint towards any of these things Deion Sanders was dealing with before the pain comes?
Yes. So most routine physical examinations will include a urinalysis. And what that does is it looks at the urine microscopically. On that test, if there's a problem in the bladder or a problem in the ureters or a problem in the kidneys, you may detect blood. And that is what usually results in referral to see the urologist. In terms of screening tests, which I think is what you are alluding to, we generally don't screen for bladder cancer because the majority of times that a person has blood in the urine, it is not related to a malignant condition. The majority of times it may be coming from, if you consider the kidney as a coffee filter, for example, if you put coffee powder or coffee grounds into the filter, and you pour water on it, you don't really see any coffee grounds in the cup that you're collecting. But as we get older, especially if there's diabetes, high blood pressure, the holes in that filter, i.e. the kidney, widen. So some of the coffee grounds would come through. And that's analogous to some red blood cells coming through into the urine. So the majority of times it is related to a filter or what we call a glomerular problem in the kidney, as opposed to a malignant condition. Enlarged prostates can also cause blood in the urine, as can urinary tract infections, as can stones, a variety of pathologies. So it generally is not cost effective to screen for bladder cancer.
Joy?
Well, first of all, Secretary Austin reminded men about the importance of getting checked for prostate cancer. Now we have Coach Prime reminding them of the importance of getting checked for bladder cancer. What increases the likelihood that you can get screening or that you might have a problem? Is it family history? And talk a little bit about how that relates and what you should be talking about in your family to discover if you are in a high-risk pool.
Yes, so important to really take an important history and give the physician the details surrounding your day-to-day activities. So if you are a cigarette smoker, that's important. In the Western world, cigarette smoking is the most common cause of bladder cancer, the most common cause of what we call urothelial cancer, which is basically the cell type involved in most bladder cancers. That same lining lines the ureters or the tubes from the kidney to the bladder and the inside aspect of the kidneys. And cigarette smoking is the most significant factor related to that. There are other risk factors in terms of getting older. We know that 9 out of 10 bladder cancers present in men over 55. So as you get older, this is something to be aware of, particularly if you have that history. Prior history of chemotherapy. There are some drugs that are used to treat leukemias and lymphomas that predispose to bladder cancer. So if you've had a history of leukemia or lymphoma as a younger individual, then knowing that the risk of bladder cancer is increased for you lifelong is also important. And then there are some hereditary aspects of bladder cancer. There's a condition known as the Lynch syndrome, which is a hereditary colon cancer syndrome, one that does not involve polyps in the colon, and that puts men and women at risk for bladder cancer. And then there are other genetic conditions that involve mutations of a particular tumor suppressor gene called P10 that is infrequently associated with bladder cancers. Additionally, exposure to dyes. So, folks who worked long ago in the hairdressing and hair salon industry where a lot of dyes were used, that's potentially a risk factor. Firefighters and inhalation of smoke, rubber and dye manufacturing industries, textiles, because of compounds like benzalkonium and benzidine. Exposures to those areas are risk factors. And then finally, if you look at Northern Africa, in the Egypt in particular, there is a parasite there that people get from washing clothes or bathing in the Nile River Delta that predisposes to a different type of bladder cancer. So, these are all things to be aware of.
Doc, my final question for you is, you said something that was critically important that I think a lot of people really ignore when you talked about family history. In fact, in Deion's case, he talked about this before when he was diagnosed with the blood clot problems. He actually got upset because it wasn't until he got diagnosed and his mother told him about the family history of blood clots. His mother and his uncles were diagnosed with blood clots. One uncle died from the blood clots. And Deion said, "Mama, why didn't anybody say anything?" So for people, Doc, it really explained to people why it's important for black mothers and black fathers to have real conversations with their children about what their parents or aunts and uncles, their health issues, because when you go to the doctor and they ask family history, they're not just talking about your mother, your father, brothers and sisters. They're like, no, your family history, your aunts and uncles and your grandparents. And so many people don't know anything about their family history and illnesses.
Yes, I think that young people have to ask and inquire about their family history, as well as, mothers, fathers, uncles, aunts, grandparents, really informing the younger generations what potentially existed in the family, even if it was a distant relative. I think that that's important because, the way genetics works, not everybody gets the condition, but many people may be carriers. And it's important to know that if you are a carrier of an abnormal gene, it's important to know that environmental exposures throughout your lifetime sort of knock off the second gene and therefore then predispose to the carcinogenesis or mutagenesis issues.
Yeah, like for instance, my mom has asthma. But I don't have asthma, but I'm allergic to smoke. And when it gets in my system, sort of the same reaction. And so although I don't have asthma, one doc said, no, you said you have asthmatic conditions.
Right. Yes, and reactive airways tend to run in families as well. And that's a very important thing to be aware of. It may not be full-blown asthma, but there may be certain things that trigger asthmatic type symptoms when you're exposed to them.
Well, Dr. Dean, great information. Glad you can join us, and hopefully, folks really learn from this, and that it will spur men and women to again check with those doctors. Look, Deion was very forthright, very open, very honest, and in fact, Joy mentioned. When Secretary Austin dealt with prostate cancer, he didn't really want to talk about it. He kept it very private. And actually, I sent him a text message saying, hey, use this opportunity to actually help others because you could be saving somebody's life. And so I'm glad to see Coach coming out and doing that. And he's made it clear he's going to be back on the sidelines. That's not going to stop him. But you're talking about a Hall of Famer who was the top of his game in sports. So trust me, he'll be attacking this like he attacked wide receivers opposing him. Doc, we appreciate it.
Thank you. Absolutely my pleasure.
Hello, I'm Isaac Hayes III, founder and CEO of Fanbase. Listen to what I'm about to tell you. The window to invest in Fanbase is closing. We've raised over $10.6 million of our $17 million goal. That means there's room for less than 6,370 people to invest in Fanbase for the average amount. The minimum to invest in Fanbase right now is $399. That makes you an owner in Fanbase today. Go to startengine.com/fanbase to invest. Why? Because current social apps have taken advantage of users for far too long, with content suppression, shadow banning, harmful racist content, and no real tools for monetization and equity. Fanbase has over 1.4 million users and counting, allowing anyone to reach all their following and monetize their content from day one. Social media is the new TV, and whoever owns the apps that distribute that content have the opportunity to own potential billion-dollar companies. While big platforms with uncertain futures are failing to serve their users, Fanbase is stepping up to fill the gap. Don't wait until it's too late. Invest now, invest for yourself and your future. Go to startengine.com/fanbase and own the next generation of social media.